Some of my patients come in with a massive heart attack and swear they never had a single warning sign. And in a way, I understand why they feel that. But the reality, and this is something I've seen play out time and again over the course of my career, is that their bodies had been sending signals for months, sometimes years. Nobody had ever taught them what to look for. Today, that changes. You're going to learn exactly what to watch for before it's too late. I'm Dr. Marcus Bennett, cardiologist, and what I'm about to share with you in the next few minutes could genuinely save your life. That's not an exaggeration. It's clinical observation, plain and simple. Is your heart actually in good shape? Or is something developing silently right now? That question is worth your attention, because cardiovascular disease remains the leading cause of death in the United States and across the world. We're talking about more than 695,000 deaths every year in this country alone, according to the CDC. Over the years, I've watched the same patterns repeat themselves. Patients arriving at the clinic or the emergency room with problems that could have been caught much earlier. That's why I want you to know these signs. The human body has a particular way of alerting us when something isn't right, and the heart is no exception. I'm going to break this into 3 well-defined sections. In the first, I'll cover 7 visible signs, things you can actually observe on your own body or on someone close to you, physical marks and changes that tend to be overlooked. In the second part, we'll go through 7 classic symptoms, what you actually feel when something is going wrong with your heart, the sensations people routinely chalk up to less serious causes, and at the end, I'll share practical recommendations that medicine has confirmed consistently, over and over again, for preventing future cardiac problems. This is going to be a thorough walkthrough, so stay with me until the end. There's information here that most people simply don't have, despite how important it is. And I'll say this: after watching this, you'll start seeing your body, and the bodies of the people you care about, with very different eyes. But before we get into it, if this content is useful to you, please like this video. The more people engage with it, the farther it reaches, including people who may not have regular access to medical care or who simply don't know what to look for. Share this video with your friends and family. Lives can genuinely be saved with your help. Share it now. And tell me in the comments, do you have a heart condition? Or do you suspect you might? Where are you watching from? All right, let's get into the 7 visible signs that may be pointing to a heart problem. These are things you can see and observe without any complicated testing. 7th sign, Frank's sign. Starting today, you'll probably find yourself looking at people's ears a little more carefully. That's not a coincidence, and I'll explain why. There's a small marking on the ear that may be associated with blockages in the coronary arteries or the carotid arteries. Back in the 1970s, Dr. Sanders Frank noticed something consistent in his clinical practice. Many of his patients with angina, that characteristic chest discomfort that appears when the heart isn't receiving enough oxygen, had a very specific diagonal crease in their earlobe. It wasn't occasional. It kept showing up often enough that he decided to study it. That finding has been known as Frank's sign ever since, and medicine has observed it across thousands of cases. What's the connection between the heart and the ear? One of the most widely accepted theories is that the same factors that damage the inner lining of the arteries, the arterial intima affected by atherosclerosis, may also produce this characteristic crease in the earlobe, as if the same degenerative process leaves its mark in different parts of the body. Worth clarifying something here: not everyone with this sign has blockages. Of every 100 people with a visible diagonal earlobe crease, roughly 30 have no significant vascular disease at all. For them, it's simply a marker of natural tissue aging. But in 70 of those people, some degree of arterial obstruction is present. And here's what makes it particularly relevant. The younger the person, the more significant this finding becomes. If someone in their 40s presents with Frank's sign, that warrants a much closer look than in an 80-year-old, where it's more likely just the passage of time. In younger patients with this sign, it's been a well-recognized pattern in practice, worth investigating further. The sensitivity of this marker is moderate. Of every 100 people with confirmed cardiac blockages, only about 40 will show this visible sign. So you can't rely on a smooth earlobe to rule anything out. Absence of the sign does not rule out heart disease. Sixth sign, hair loss on the legs. Hair loss on the legs, typically starting at the shins and gradually moving upward toward the thighs, can be a quiet indicator of peripheral arterial disease. That means there are blockages in the arteries supplying blood to the lower extremities. And this is a pattern I've seen repeat itself consistently over the years in clinical practice. Atherosclerosis is not a localized disease. It's diffuse. It doesn't affect just one area of the body. If blockages are present in the arteries of the legs, it's quite likely they exist elsewhere as well, including the arteries supplying the heart. The process is identical. Fatty plaque buildup doesn't discriminate between one artery and another. Most people with peripheral arterial disease only realize something is wrong when the atherosclerosis is already fairly advanced. They come in complaining of pain when walking, heaviness in the legs, but that hair loss was already there, often for a long time. Nobody thought much of it. Why does the hair fall out? Because hair follicles need nutrients to sustain growth. They need a steady, adequate blood supply. When the arteries are obstructed by plaque buildup, that area doesn't receive proper blood flow or oxygen. It's like trying to water a plant with a clogged hose. Not enough gets through. Beyond the hair loss, other changes may also be present. Skin that appears smoother and shinier, as if thinner. A persistent sensation of coldness in the legs, even in warm environments. And noticeably, slower toenail growth. Of course, genetics can also cause leg hair loss, as can chronic friction from tight pants worn over the years. But when this combines with other signs we're about to cover, the clinical significance increases considerably. Fifth sign, xanthelasma. You may have noticed someone with a yellowish patch near their eyelid and wondered what that was. It's called xanthelasma, and in my experience, it's one of the most visible indicators of a problem with fat metabolism. It doesn't hurt. It doesn't itch. It's generally a cosmetic concern that grows slowly over time. Xanthelasmas are the most common type of xanthoma, essentially deposits of cholesterol that accumulate beneath the skin. They appear more frequently in middle-aged women and tend to form at the inner corner of the eye, primarily on the upper eyelid, though the lower lid is also possible. Around 50% of patients who develop xanthelasma have dyslipidemia, elevated cholesterol or triglycerides. That's 1 in 2, and that proportion is high enough to take seriously. Here's something the evidence has been consistent on. Only about 1% of people with high cholesterol actually develop visible xanthelasmas. That sounds small, but what really matters is this. Research has demonstrated repeatedly that having xanthelasmas increases the risk of heart disease, heart attacks, and stroke, independently of other known risk factors. So if xanthelasma is present, the sensible approach is to get comprehensive blood work done, check total cholesterol, LDL, HDL, and triglycerides to confirm whether levels are elevated, and if they are, take steps to address them before the problem progresses. Ciao für tidintuin. Call fourth sign Arcus senilis. As the name suggests, this one tends to be more common in older patients, and it's something I see in practice virtually every day. It forms from cholesterol deposits along the edge of the cornea, with a characteristic whitish or grayish appearance along the upper and lower outer edges of the cornea, like a ring that partially or fully encircles the iris. Some people may notice that their eye color, once deep and well-defined, seems to be gradually lightening around the edges. It's a slow change, and often someone else notices it before the person does. Arcus senilis has no effect on vision and requires no specific treatment. It's simply a marker, a visible signal the body leaves on the surface. There is, however, one important exception worth highlighting. When this ring appears in younger individuals, under 45, it may indicate that the person has severe dyslipidemia, meaning very elevated cholesterol or triglycerides. In that case, it is associated with a considerably higher risk of early-onset heart disease. In older individuals, Arcus senilis is completely normal and expected. Around 60% of people over 60 have it, and by age 80, the figure approaches 100%. So if you're over 60 and notice that whitish ring around your iris in the mirror, there's no cause for alarm. It's part of natural aging. Third sign, cyanosis. Cyanosis is that bluish or purplish tint that appears in the skin, and it's something that always deserves attention when there's no simple explanation. Can it be from cold? Yes, it can. In very cold temperatures, blood vessels constrict, and the skin can temporarily take on a bluish tone. That's normal and resolves when you warm up. But cyanosis can also signal a more serious cardiac or pulmonary problem. If an area of your skin appears cyanotic, that bluish or purplish tint, when you're warm, when you're in a comfortable environment, it may be a clear sign that area isn't receiving adequately oxygenated blood. Oxygenated blood is red and bright. When oxygen is insufficient, it becomes darker, more bluish. An artery may be obstructed and not delivering enough flow to that region. If the person also has difficulty breathing, shortness of breath, or a persistent cough, it could point to a pulmonary problem, pneumonia, emphysema, pulmonary embolism, or it could be heart failure, the condition in which the heart can no longer pump enough oxygenated blood to meet the body's needs. Other cardiac causes are worth noting as well, including congenital defects. Tetralogy of Fallot, for instance, is a cardiac malformation that produces cyanosis from birth or early childhood. But in adults who develop cyanosis as a new finding, this always requires urgent medical evaluation. Second sign, non-healing ulcers wounds that appear on the legs or feet and simply won't close, that remain open week after week, may be signaling poor circulation. This is a well-recognized pattern in practice, particularly in patients with diabetes or vascular disease. It may be due to arterial insufficiency, a blockage in the artery supplying that specific area. And generally, people with this type of arterial ulcer can't walk very quickly or for very long because their legs tire rapidly, hurt with exertion, or develop intense cramping. That's what we call intermittent claudication. Most of the time, these arterial ulcers are painful, sometimes very painful. But if nerve damage is present, as occurs in diabetic neuropathy, it's possible the person feels no pain at all despite having an open wound. And that's dangerous, because it can worsen without the person realizing it. Arterial ulcers have specific characteristics. They tend to appear on the outer leg, on the heels, and on the toes. The surrounding tissue looks pale, cold, and these wounds typically don't bleed much, because there's very little blood flow reaching that area. The other category is venous ulcers, which are more common and are related to vein problems such as varicose veins or a history of venous thrombosis. Unlike arterial ulcers, venous ulcers primarily affect the inner leg, especially near the ankle. they tend to bleed more easily, and the surrounding tissue shows discoloration, darker, with patches. Chatukoidorn. First sign, swelling in the legs, ankles, and feet. This swelling, or edema, as we call it clinically, in the legs and ankles can be caused by a weakened or enlarged heart that leads to fluid accumulating in the body. It's one of the most common visible signs of heart failure. When the heart can't pump with adequate force, blood begins to pool in the veins, returning from the legs toward the heart. That increased pressure causes fluid to filter out of the blood vessels into the surrounding tissues. And that's when the swelling appears. You may notice your shoes don't fit the same way, that your sneakers feel tighter at the end of the day. The ankle looks puffy, swollen, like dough that's been rising. When you press it with your finger, a small indentation remains that's slow to spring back. That's what we call pitting edema, and it's very characteristic of fluid accumulation from heart failure. You're more likely to notice this swelling at the end of the day, after standing or sitting for several hours, because gravity increases the pressure on the leg veins. And if you lie down and elevate your legs above the level of the heart, the swelling typically reduces noticeably. That's a typical feature of cardiac edema. Now, not every case of leg swelling points to the heart. It can stem from kidney problems, liver issues, certain medications, or venous disease. But when it combines with other symptoms we're about to cover, the heart becomes the primary concern. Now, let's cover the 7 symptoms. What you actually feel on a day-to-day basis that may be pointing to a heart problem. These are things people experience and routinely attribute to other, less serious causes. Tone. First symptom, shortness of breath or dyspnea, especially with exertion. A disproportionate fatigue relative to the effort made. You run out of breath more easily with everything you do. Activities that used to be effortless, climbing one flight of stairs, for example, now leave you winded. This could be related to a cardiac problem. When the heart isn't pumping efficiently, it can't meet the body's oxygen demands during exercise or effort. The result is that sensation of breathlessness, of not being able to take a full, deep breath. Second symptom, persistent cough with white or pink-tinged phlegm. This means fluid is accumulating in the lungs, in those tiny air sacs called alveoli. Don't dismiss that cough, especially if it's persistent, and produces foamy, whitish, or faintly pink phlegm. The pink tint appears because there's a small amount of blood mixed into the fluid. It's a sign that the heart isn't pumping effectively, and fluid is backing up into the lungs. Seek medical attention if this occurs. Third symptom, difficulty breathing. When lying down, the person starts stacking more pillows, trying to sleep with the upper body more elevated because it helps them breathe. Over time, lying completely flat becomes impossible. They end up sleeping nearly upright in a chair or propped up high on pillows. They may also wake up in the middle of the night gasping, that alarming sensation of not being able to breathe. This is called paroxysmal nocturnal dyspnea, and it's a well-established hallmark of heart failure. It happens because, when you lie down, the fluid that had pooled in the legs during the day redistributes and can move toward the lungs, compromising breathing. Fourth symptom, generalized weakness. A constant sense of fatigue from the moment you wake up to the moment you fall asleep. Difficulty managing daily activities that used to be routine. Grocery shopping, climbing stairs, carrying bags, or simply walking a few blocks. This happens because the heart can't pump enough blood to meet the needs of the muscles and tissues throughout the body. The muscles aren't receiving the oxygen they require, and they fatigue quickly. It's like trying to run an engine without adequate fuel. Fifth symptom, nocturia, having to get up multiple times during the night to urinate. 2, 3, 4 times or more. This is called nocturia, and while it has several possible causes, in the context of heart problems, it occurs because, during the day, when you're upright, fluid accumulates in the legs due to gravity. When you lie down at night, that fluid redistributes, and the kidneys begin working to eliminate it, resulting in repeated trips to the bathroom. Sixth symptom, intermittent claudication. After walking a short distance, maybe half a block or a block, you feel pain in the calf, in the back of the lower leg. This isn't just any pain. It only appears with the effort of walking, and when you stop and rest for a moment, it improves or disappears entirely. This symptom means blood isn't reaching the leg muscles as it should. The arteries are obstructed. When you stop, the oxygen demand drops and the pain eases. When you resume walking, demand rises again and the pain returns. It's a very characteristic pattern, and one that medicine has understood well for decades. Seventh symptom, chest pain. If you are having chest pain, the first thing that needs to be considered is a cardiac cause. You cannot automatically assume it's muscular, gas, or something minor. It could be. Most chest pain is not from the heart, but the most serious causes always need to be ruled out first, because the consequences of being wrong can be fatal. Cardiac pain, angina, or the pain of a heart attack, is a discomfort or pressure in the chest that lasts more than a few minutes. It may come and go in episodes. It can feel like pressure, as if something heavy is sitting on your chest. Heaviness, tightness, or a burning sensation, like heartburn but more intense. It may radiate, spreading to the left arm, which is the classic presentation, but also to the neck, back, jaw, stomach, or both arms. It may or may not be accompanied by cold sweats, pallor, nausea, dizziness, or a sense of impending doom. If you experience these symptoms, especially if they last more than a few minutes or keep coming back, see a doctor as soon as possible. Don't wait. Time is heart muscle. Every minute that passes without treatment, more cardiac tissue can be lost. The evidence on this is settled. And now we come to the most important part, prevention. How do you avoid developing a cardiac problem down the road? Medicine has understood this well for a long time. These are recommendations that have been tested across millions of people over decades. 1. Get regular physical activity. Get up from that chair. Don't stay sedentary. Physical activity is fundamental for circulation, for keeping your heart strong, and for mental well-being. You don't need to run marathons. Low-impact activities, walking 30 minutes a day, cycling, swimming, can significantly improve blood flow, even in cases of chronic arterial obstruction. Exercise helps manage weight, improves the cholesterol profile, reduces blood pressure, and improves blood sugar control. It's probably the single most powerful intervention that exists. 2. If you smoke, stop. This is one of the worst things you can do for your cardiovascular health. Smoking damages blood vessels, inflames all the arteries in the body, accelerates the formation of fatty plaques, raises blood pressure, and makes blood more prone to clotting. All of that dramatically increases the likelihood of a heart attack, stroke, and vascular dementia. There is no safe level of tobacco use. Even a few cigarettes a day cause significant harm. The body responds the same way, every time. 3. If you're overweight or obese, lose weight in a healthy, sustainable way. Excess weight isn't just a cosmetic concern. It raises blood pressure, worsens blood sugar control, generates chronic low-grade inflammation throughout the body, puts constant strain on the heart as it works to supply more tissue, damages the kidneys, overloads the joints and venous system, increasing the risk of deep venous thrombosis, and promotes fatty liver disease. Losing even 5 to 10% of body weight already brings meaningful cardiovascular benefits. 4. Eat well most of the time. Plenty of fresh fruits and vegetables, fiber from varied sources, whole grains instead of refined ones, extra virgin olive oil as your primary fat, fish, nuts, and limited red meat, processed meats, and ultra-processed foods loaded with sugar, salt, and poor-quality fats. You don't have to be perfect. You have to be consistent. What you eat most of the time is what actually matters. 5. Know your family history. If your father, mother, or siblings have had heart problems, if your father had a heart attack at 50, if your mother had a stroke, if your brother needed a stent, you need to be more vigilant than most people. Genetics plays a real role here. If multiple people in your family have suffered cardiac events, especially at relatively young ages, deeper testing is warranted and more aggressive prevention should begin earlier. That's been a consistent pattern across thousands of patients. 6. Monitor your cholesterol and triglycerides. Eat more oats. Soluble fiber makes a difference. Reduce trans fats to a minimum. They're the worst. Cut back on saturated fats. Lose weight if needed. Increase your fiber intake from multiple sources. Exercise regularly. And if, after doing all of this correctly, your levels still don't come down enough, don't be reluctant if your doctor recommends medication like statins. The liver produces around 80% of the cholesterol circulating in your blood. Even with a solid diet and consistent exercise, it sometimes isn't enough. And that's fine. Medications exist precisely for that reason. 7. Keep your blood sugar under control if you're diabetic or pre-diabetic. Controlling glucose levels dramatically reduces cardiovascular, kidney, eye, and neurological complications from diabetes. Hemoglobin A1C, which reflects your blood sugar control over the past 3 months, should be below 7% for most diabetics. In some cases, the target can be less strict, in others more so, depending on your specific situation. 8. Control your blood pressure. The goal is to maintain blood pressure below 120 Pfizer's 80 intrahertz Meg. That's the ideal target for most people. For some, particularly older adults, or those with certain conditions, the target may be less strict, such as below 140.20. But in general, the lower your blood pressure within safe ranges, the better for your heart, your arteries, your kidneys, and your brain. And that's not opinion. That's what the data shows. And of course, if after watching this video you believe you may have a cardiac problem, if you've identified several of these signs in your own body, and you're experiencing some of the symptoms I've just described, don't let it go. See a doctor. Tell them exactly what you've noticed, what you're feeling, and follow their guidance. An early diagnosis can make all the difference. Medicine has understood these patterns for a long time. The body sends signals. We just need to learn to recognize them. If this video was helpful to you, please share it so more people have access to this information. It can genuinely save lives. And what's the next video you'll watch? I'll leave 2 recommendations here. My playlist on heart attacks, where I go deeper into causes, symptoms, and treatment. And my playlist on hypertension, with everything you need to know to bring your blood pressure under control. I'm Dr. Marcus Bennett. Subscribe so you don't miss any upcoming content. See you in the next video.